The information you will listen to in this video has been prepared by making use of the package insert of the drug. If this video is useful for you, don't forget to like the video and subscribe to the channel for support. The active ingredient of Celexa, which is in the group of antidepressant drugs, is citalopram. What is Celexa and what is it used for? Celexa is a prescription medicine used to treat the symptoms of depression. Celexa may be used alone or with other medications. This medication works by helping to restore the balance of a certain natural substance in the brain. How to use Celexa? Read the medication guide and, if available, the patient information leaflet provided by your pharmacist before you start taking citalopram and each time you get a refill. Take this medication with or without food as directed by your doctor, usually once daily in the morning or evening. The dosage is based on your medical condition, response to treatment, age, laboratory tests, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. If you are using the liquid form of this medication, carefully measure the dose using a special measuring device spoon. Do not use a household spoon, because you may not get the correct dose. To reduce your risk of side effects, your doctor may direct you to start taking this drug at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Do not increase your dose or use this drug more often or for longer than prescribed. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. It may take 1 to 4 weeks to feel a benefit from this drug and up to several weeks before you get the full benefit. Here are some things to know before using Celexa. Before taking citalopram, tell your doctor or pharmacist if you are allergic to it, or to escitalopram, or if you have any other allergies. Citalopram may cause a condition that affects the heart rhythm. QT prolongation can rarely cause serious fast irregular heartbeat and other symptoms that need medical attention right away. This drug may make you drowsy or blur your vision. Do not drive, use machinery, or do anything that needs alertness or clear vision until you can do it safely. Drug interactions may change how your medications work or increase your risk for serious side effects. Keep a list of all the products you use and share it with your doctor and pharmacist. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. This drug passes into breast milk and may have undesirable effects on a nursing infant. Consult your doctor before breastfeeding. Possible side effects with the use of Celexa include: with the use of the drug, nausea, dry mouth, loss of appetite, tiredness, drowsiness, sweating, blurred vision, and yawning may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If this video was useful for you, like the video and subscribe to the channel for support. Share your views and experiences in the comment section. I wish you healthy days.